Hi Laura, my name's Amanda and I'm going to be your dental hygiene student today.
Hi.
Thanks for coming in. We're going to talk about plaque and toothbrushing today.
Okay, sounds good.
So from your assessment today, I did notice a few things. I'm noticing that you had some sensitivity to sweets on your back teeth and some bleeding in your gums when you floss. Your plaque score was about 3.5, which is poor, and your bleeding score was 62%. I am seeing some red and puffy gums, and I'm seeing a few cavities on your back teeth. Can you tell me a little bit about your brushing habits?
Yeah, sure. I brush my teeth once a day, usually in the morning. If I got something stuck in my teeth, I floss them. I do drink a lot of Dr. Peppers and caramel lattes, and I suck on peppermints all the time to get rid of the taste. So maybe that's the sensitivity to sweets. I don't know.
Yeah.
But that's kind of my routine. But by the way, what was the bleeding score that you talked about?
Sure, that's a great question. A bleeding score is how we measure the health of your gums. So we'd like for that to ideally be as low as possible. The lower the score, the healthier your gums are.
Okay, good.
Yeah, and so just we're on the same page, I do have a few goals for you. We have a long-term goal of decreasing your plaque score from 3.5 to 0.5 by your next appointment in 6 months. And then we have some short-term goals to help us achieve that long-term goal, and that's going to be to help you understand what is plaque, and also to help you understand a proper toothbrushing technique to achieve a more plaque-free environment in your mouth, and we'll incrementally decrease your plaque score at each visit. So that's our goal for today. Okay, so let's start by talking about plaque.
Okay, so I see on your slides that you're saying, what is plaque? And honestly, I've heard of it, but I really don't know what it is. So can you tell me what it is?
Absolutely, I'm glad you asked. So plaque is going to be something that's a soft, sticky deposit in your on your teeth. And under a microscope, it really boils down to a multi-species of bacterial biofilm, and it can stick to everything in your mouth.
Okay.
And if we leave that plaque there, that bacteria is going to cause the redness and bleeding in your gums. It's also going to contribute to cavities because it will create an acid byproduct that will attack your enamel, and that can degrade the enamel and allow cavities to form. And then over time, it could lead to gingivitis and periodontitis. And once you have periodontitis, that includes bone loss.
Oh, wow. Oh, okay.
Mm-hmm.
So how does it get there in the first place?
So right after you brush your teeth, there's a thin translucent film that develops within 30 to 90 minutes. That's called a pellicle. And then after that starts to form, the bacteria can adhere to that. And over time, the bacteria will create what we know as plaque over the course of about 4 to 12 hours between brushing, which is why it's important to brush twice a day.
Oh, okay.
Yeah. After about 72 hours, the bacteria can really spread throughout your mouth. So it's very important that we keep it clean.
Okay, good. So where does it stick exactly? Is it just kind of on the fronts of my teeth, or?
It certainly can stick to the front surface of your teeth, but it really likes to hide in the crevices and the areas that are hard to reach when you're cleaning. So that would include areas between your teeth and in the back sides of your teeth that are really hard to get with brushing, which is why it's important to floss.
Okay.
It can also stick to your tongue.
Okay.
Mm-hmm.
So how do I get rid of it? How often do I do it?
So the best way to get plaque off of your teeth is to brush at home. We can mechanically disrupt it with a toothbrush, and brushing it away and making sure that we're using the proper brushing technique, flossing and brushing our tongue is the most effective way to remove it at home. So we want to make sure that we're brushing twice a day for 2 minutes at a time, flossing at least once a day, and brushing from back to front.
Okay.
So now that we've learned about plaque, why don't we go ahead and talk about toothbrushing?
Sounds like a plan. Thanks.
Okay.